Health officials are reiterating the importance of immunization as they work to contain a measles outbreak in northern Alberta. The highly transmissible airborne viral illness is flaring up in North America, and some speculate confusing messaging is adding to the issue. Tim Brooke explains.
John Doerr Prairie is one of 3 communities that make up the Little Red River Cree Nation in northern Alberta. On Sunday, it made headlines.
There's a worldwide increase in measles, and it's a concerning finding to see a case in Alberta.
Officials tell CTV News there have been 6 confirmed cases and 1 probable case of measles. An investigation is underway.
The big issue is the contacts and then trying to figure out where these individuals were exposed. This came from somewhere else.
The illness has been moving quickly throughout North America in 2025.
It just spread so violently to large numbers of people, in the time before you get a rash and know what's going on. So it's a difficult one to contain, honestly.
And it's a tough thing to deal with. Health experts say more than a quarter of cases need to be hospitalized for supportive care, and every case needs to isolate for 3 weeks. The good news? Measles is easy to avoid.
This is almost the standard of vaccine-like success because it's highly effective at preventing disease in the realm of 97 to 99%.
But Thursday, Alberta's health minister still wouldn't recommend all residents get the measles vaccination.
It is a parental choice, and parents and guardians have to make sure that they're well informed and make the best choice that's right for them and their families.
Adriana LaGrange says her family has had the shot, but stopped short of endorsing it for everyone else. It's reminiscent of the province's stance on other vaccines and completely contrasts the approach just north of Alberta.
I urge all residents to check their vaccination status and make sure that they are up to date. Science has given us the tools to fight this disease. It's up to us to use them.
Tim Brooke joins us now, and Tim, John Doerr Prairie has stepped up its immunization efforts.
Well, there's a concerted effort, Cam, to do that in all areas right across our country that currently have outbreaks. The latest federal data shows in the first 2 months of this year in Canada, there were 168 reported cases of measles. Hence, well, those numbers just climb when you track south of the border. And so Health Canada also wants to remind everyone tonight to make sure they're up to date on all their vaccines before they do any sort of spring travel. Cam, Canadians can check their online health records to make sure that, let's say, they were, in fact, vaccinated for measles as a child.
All right, Tim, thank you very much.